Hello and welcome to another video in which I'm going to review a human case that I already did. It involves Amina Johnson, a 23-year-old college female who presents with a reason for encounter of fever and sore throat. Now I already handled this case, so I'll just walk you through what I did. Usually the first part of any human case is the history, where you are supposed to ask certain questions to establish patient health status and maybe determine the right diagnosis depending on the reason for encounter, which usually are just symptoms. Now there are there are two ways of asking these questions. That is, if you know the questions, you can just ask them, and also you can use the search option or even use the microphone to ask the questions, or use specific keyword that helps you get the questions. Now, for example, you can see when I keyed in the word allergies, I got the question, and ask it. Then, when I needed that question, I just used two keywords: herbal medication, and when I needed to know about the patient's flu shot status, I only used the two keywords. Now, usually I'm a fan of using the search option, because when you already know the questions and you don't want to take a lot of time going through all the questions, then it's the shortest way of getting these questions. Now you have to understand that some questions are general, meaning they can apply to maybe more than one patient or more than one symptom, but some of them are specific. Now the specific questions, they are used to help you understand the actual health status and maybe other symptoms that may be related to the patient's reason for encounter. Now, like a real life situation, when you're dealing with a patient, then you realize that the questions that are asked or the patient's reason for encounter is always symptoms. Now, one symptom or maybe two symptoms can be related to more than one health condition. So that's why you have to ask specific questions that are really related to that, to a specific symptom, or if it is one, or if it is more than symptoms, then you really have to try as much as possible to exhaust the questions that may help you make the right diagnosis. Now, in this case, one of the patient's reason for encounter is sore throat. So for a patient who has sore throat as a symptom, then you have to go a step further and maybe ask if he or she also has a cough. In our case, our patient didn't have a cough, meaning it is only the sore throat. So then you have to try to look for other symptoms or other health condition that can be associated with the sore throat or the fever. So a person with sore throat is likely to have a problem swallowing, especially if the throat also if the patient also has swollen glands, then you just have to, you can guess that this person probably also has problem swallowing. So that's why I asked this specific question. Yes, then also depending on the symptoms or patient reason for encounter, then you always have to ask about the severity of the problem. Now remember, when you're dealing with any human case, there are formulas. There's some formulas that you can use in asking questions or assessing a patient. Now, one of the most used formulas or approach or process or strategy when dealing with these cases is the old cuts approach. That is the old cuts are abbreviation, meaning you have to deal with the onset, location, duration, characteristics. Now, if there is anything making the symptom aggravating, then anything that maybe makes the symptom maybe gives the patient a relief, and also the treatment if the patient has had any treatment for any of those symptoms, and then the severity. So the first letter of what I just described gives you the acronyms, all the cuts. For example, when I ask the question, when I ask a question such as when I ask any question, then I have to really link them to the reason for encounter of the patient symptoms, and also have to ensure that I'm following the all cuts approach. Yes, so when I ask if the patient has if the patient has any medical issues, then these are questions that is mainly designed to determine is a question related to the patient treatment, because whenever you're dealing with a patient, one of the things you'll do to this patient is to maybe prescribe some medication. So you have to see if this patient has any problem with the medicine that maybe he or she is already using, or the one that maybe intend to prescribe. So a question like one related to the recreational drugs. Now this is a question used to determine the patient's social life, because a person's social life is or social activities are some of the things that can lead to a patient's health status or can affect a patient health status. Now, when you're done with the questioning, then you have to move to the EHR section where you key in your findings. Some of the findings are what you use to fill the EHR. For example, the first activity in EHR is patient reason for encounter. Now, in this case, I simply quoted what the patient gave us an answer, which is, I have a really bad sore throat. So this is this patient's reason for encounter. So the patient, if you remember, the patient's reason for encounter were two symptoms, which were fever and sore throat. But now, when you assess this patient's response, then you realize that the patient is more bothered about the sore throat than the fever. So then that's the reason for encounter. Then another section that you are also required to key in is the history of present illness, which in this case you have to make it as detailed as possible, so that whoever has access to that EHR gets to understand in details what the problems, what the patient's problem really is. Now the next part in EHR is always a review of systems, which involves asking specific questions to determine the patient's overall health status. he or she could be having just the two symptoms which were the reason for encounter, but if you don't dig deeper, then you might not know what the problem is, also what other problems could be underlying these symptoms. So for the review of systems, just as the name suggests, it's a question related to different systems of the body. So that means you start with the patient's overall health, and again, like I did in the first part, which was reason for encounter, I simply quoted the patient's response. Now, after that, then you have to assess the patient's EHEENT or hint, as other people say it, and this it relates to body systems, from the head area, from neck to head, which include the eye, the throat, the neck, the head, the ears. So once you're done with that, then you also have to assess other systems such as the musculoskeletal, genitourinary, breast, psychiatric, immunologic, allergic. Now, the answers to these systems comes from patient response to specific questions that were asked really regarding the same areas. Now, once you're done with the EHR, the next section is you have also to give history notes, which are notes regarding the patient's health status. Now, from our assessment of the history questions, then we realized, or we found, that this patient has basically 4 symptoms. Despite only listing 2 of these symptoms are reason for encounter, she has 4, which are fever, sore throat, headache, and swollen lymph nodes. So what you do, as I had actually mentioned earlier, you have to follow the all cuts approach, or formula or strategy in answering these questions, which you have to give all the answers regarding each of the 4 symptoms. Now the next part is always you're supposed to list your key findings, which comes from the patient response. And once you're done with that and you proceed to the next section, or before proceeding, you get a feedback from the system, or regarding the patient's health history. In this case, I missed a few answers, a few questions, which simply mean these were also questions that I should have asked to assess the patient's health. Yes, so in this case, I was supposed to ask this patient if how the symptoms, or how the reason for encounter makes her feel generally. Now, once I know that, and I get this from this response, I realized that I must have missed a few assessment questions that I'm also supposed to key in the EHR section. So I had to move back and do that, and key in the right data regarding this from this response, or from this feedback, where I found that I must have missed a few things, or a few questions that were required to help assess this patient's overall health status, and also regarding the reason for encounter, or as well as the other symptoms that were identified in history note section. So from these answers, what I was doing in this section is I was looking at the questions and the required questions and the answers, and then counter checking them with what I'd keyed in the AHR section. Now after history, then you have to move to the next section, which is conducting a physical exam. Now before you do that, before you start the physical exam, yes, you are required to visit the EHR section, because it always covers some information or some information about the patient that you are supposed to assess. Yes, some of these physical exams that you are required to carry out includes the pulse, patient's pulse, blood pressure, respiration, temperature. So I was moving between the test and the EHR to ensure that I have the right response or right information that I'm supposed to test. And then once you're done with all the tests, then findings from this test or response are given for each or most of the physical exams are what you use to fill in the EHR section for the physical exam. As the video shows, the physical the first part is history, then the next part where you're also required to fill in is the physical exam section. Then once you're done filling in all the all the section, then you have to proceed to the next section, which is the feedback from the physical exam. Now again, I missed about 4 exams which I either did partially or didn't do correctly. So then there was also an exercise after, which is also part of the physical exam. So it basically required you to identify some of the symptoms that must have been observed through physical exam. So in this case, about 9 symptoms were required, and I identified all of them correctly. So once that was done, then you have to move to the next section, which is assessment. And in assessment, the first thing is to organize the key findings. Now at this stage, you have to add more key findings from the physical exam, and then you get the feedback, which is simply a comparison from your findings and the case findings. So as you can see, I have maybe the basic key findings, but I was also supposed to add more according to the case. Then once you have your key findings, then you can draft a problem statement, which is basically a review or an assessment of the symptoms and other responses from the patient. Now, one thing with Ihuman is nearly all the requirements come from history questions and physical exam. The assessment, I'll use them to assess patient's health. The feedback or the response, and the feedback from physical exam and the response from the patient are what you use to draft your problem statement, which is part of the assessment. And again, that the same data is what you use in the rest, the remaining parts or sections of the case. As you can see, then in this case, the test was carried out by the case, so you simply have to assess that data and use it to get the right diagnosis, which in this case was pharyngitis group A streptococcal. And then once you have that data, you simply have to use it to draft a detailed treatment plan, which has to include some diagnostic tests required for this patient, pharmacological care for some of the medicine that this patient is required to take. You are also supposed to give patient education on some of the things, or what we call, or what some people refer to as home remedies that can help this patient recover from his or her problem. Now in this case, for diagnostic test, I suggested the 3 tests that were already carried in this case. And then for medications, I gave 2 options, one of which is the Tylenol or acetaminophen that the patient already uses. Then I also suggested the amoxicillin. Then for referrals, suggested consults or referral, then there is no reason for this patient's referral. So I simply moved to patient education, where I gave a few suggestions of some of the things that can help the patient recover. And then I also gave, lastly, I gave a suggestion of a follow-up, which simply highlight or gives specific timeline that the patient needs a follow-up from the clinic. And that's all I did for this case. And after which, because after drafting my plan, I also gave a reference where one can use for further assessment or to acquire more knowledge about managing such a diagnosis. And that's all I did for this case. Thank you for watching.